So Sally, could you tell us a little bit about your experience with IDD therapy and how you came to get involved with the treatment programme?
Yes, well, I've been an osteopath now for 28 years, and about 3 or 4 years ago I started suffering with quite bad back problems myself. I found it difficult to work. I couldn't sit down for more than 20 minutes at a time, and I had an MRI scan and it showed that I had disc problems in my neck and my low back. I had pins and needles all the time in my hands and my feet, and I was in a lot of pain as well, so it was very difficult to do general day-to-day tasks.
So was that affecting your work?
Yeah, my work very much was affected. I had to see one patient, then have a break, do exercises, then get back to work, and it was really difficult because also I had to pretend that I was fine, and although I was suffering probably worse than some of the patients.
As an osteopath, were you were receiving some treatments for your pain, or were you kind of putting on a brave face, or how are you dealing with it?
I did have regular osteopathic treatment, which really helped me, but then I would find I do something silly, I'd lift heavy shopping, or I'd mow the grass, or I'd do something which was too much, and I'd be back to square one again.
And I think your first contact with IDD, you visited a clinic in Scotland. Can you tell us about that experience?
Well, at that time there were only 2 machines in the country, both of them in this clinic in Glasgow. So my partner said, right, Sally, you need to get your back sorted, go to Glasgow, see what you think. So I went. It was a bit of an ordeal getting there because I drove an hour and a half to the airport, and that made my back worse. Then I sat on the plane for another hour and waiting rooms and things, and by the time I got to Glasgow I was really quite bad again. I spent the day in Glasgow at the clinic and saw them treating patients, and of course standing up all day, again my back was really quite bad. At the end of the day I had a treatment on the IDD machine and it was extraordinary. I felt immediately better. I felt straighter. I suddenly just got my confidence back again. I was able to move better and just more flexible generally. And I went back catching the plane and the car journey, and I got back home feeling a lot better than I did before. And on the basis of that experience, then you bought your first SPINA machine and put that in your clinic? Yeah, so I spoke to my partner. I said, this is amazing, I think we've got to get one. So we got our first IDD machine. I then had a course of treatment, and we introduced several patients to the machine and who underwent the treatment plan, and we started to get really good results with our patients and have continued to do so. Yes, so I'm really excited. I'm in this new venue near Canary Wharf, beautiful premises, lovely atmosphere here, wonderful new machine, and I'm really looking forward to treating loads of patients on the machine.